These patients are losing their weight slowly, and we're building their skin as they worsen their skin because of their weight loss.
Meet Dr. Andreas Nikolis, board-certified plastic surgeon licensed in Canada, the United States, and Europe. As an associate professor at McGill University, he pursues his passion for education with his position as the National Medical Director of Victoria Park Medispa. He continues to lecture worldwide on a range of surgical and non-surgical innovative aesthetic procedures. Dr. Nikolis is at the forefront of medical aesthetics research on GLP-1 medication-driven weight loss, commonly known as Ozempic, Wegovy, and Mounjaro. His research has uncovered surprising effects that go beyond the number on the scale. What's the real price of shedding pounds this fast? Keep watching to find out.
Hello, Dr. Nikolis. How are you?
It's a pleasure to be here. I'm great. Thank you.
Thank you for being with us. I'd like to introduce Dr. Andreas Nikolis. Dr. Nikolis is a board-certified plastic surgeon, as well as Victoria Park Medispa's National Medical Director.
It's a pleasure to be here.
Really nice to have you. So we have Dr. Nikolis here with us today to talk about a very hot topic, which is medication-driven weight loss and the impact on the beauty world, on the medical aesthetics world. Dr. Nikolis, you're a key opinion leader in this topic, in fact, globally. Is that right?
That's correct.
What does that mean exactly?
So usually there are a lot of experts, and a lot of experts can develop their expertise through clinical acts, through research. When you combine all these things, clinical with research speaking, you become a key opinion leader in the field. So you have a profound knowledge of a specific topic, and you develop that topic and sort of direct the industry with the knowledge that you have or your peers have in creating goals and outcomes, and that leads you to becoming a key opinion leader in the topic itself.
So what have you been doing lately around this topic?
So medication-driven weight loss, and you've heard acronyms like Ozempic face, which is actually the name brand of a product, actually.
Kind of like saying Kleenex.
Exactly right.
Yeah.
Exactly right. It's something that's very hot, but it's been very hot for a couple of years now. And the reason for that is these are based on medications, GLP-1 agonists. These medications kind of slow down your urge to eat. And with that, as a consequence, you lose weight. The issue is that this is a very hot topic because now we're seeing a lot of these patients in our clinics. Patients who would otherwise lose weight in a slower fashion, or perhaps not change their weight, are now losing their weight because they're taking these medications. The impact of this is that they're actually changing the way that their aesthetic appearance is evolving. And what I mean by that, there are many implications. There's everything from skin, to your fat pads on your face, to your muscles on your body. There's a lot of different interplays, and you're changing. The patients are actually changing, and this is a unique patient population. We've never seen this before. We're increasing the number of these patients that we see on a daily basis. We see quite a few of these patients because we are a referral center for this kind of an issue. But they are a whole new breed of aesthetic clientele because we have to treat them very differently. And we're publishing on this exact topic, and the publication is coming out in the next couple of weeks. You have to think of this as a separate entity.
So it's sort of redefining this particular segment of customers or patients, as you're saying. It's sort of redefining medical aesthetics for this.
Medical aesthetics. In fact, in a recent conference that I was at, I actually said something exactly along those lines. Look to your right and look to your left. Every single one of your colleagues in this room is treating likely at least one patient who's had this medication-driven weight loss. But you need to understand that these are very different patients. We can't apply the normal protocols. Our teaching sessions, we do a lot of medical education on aesthetics. Would go A, B, and C. Now we're changing the order. We're going to C before B, before A. We're going after the skin and skin health before we actually even see the patients lose weight. We're trying to capture the health benefits of treating these patients early on so they don't have the sequelae of rapid weight loss.
So are you, the medical professionals, and as the key opinion leader, kind of still learning about how to treat this patient base?
So we're fortunate enough that we've actually treated quite a few patients And as such, we're helping roll out the methodology of how to treat them for everyone else. So our first publication was an international consensus paper with experts from all over the world, and all of us had to have a certain volume of rapid weight loss patients in our clinic. So not only were you an aesthetic expert, but you had to see a lot of these patients. And we developed algorithms together, we developed consensus documents. And the next paper coming up in the next month or two will actually look at specific treatment regimens for all of them. What we've been doing every single day when seeing these patients, we're now putting into practice for the rest of the world to follow.
I find this so interesting because as a marketing person at Vic Park, one of the things that we stand behind is the fact that we are led by industry experts and specialists in the field. And it's probably difficult for people to really grasp what that means exactly. And I think that's just such a key, such a key way to define us as experts, is you are doing, along with your colleagues, are doing all the research behind this emerging trend to then come and teach other Victoria Park Medispa doctors what those algorithms would be.
Right. So it's not only to identify how to use them, but it's the implementation of them, the supporting systems around them, and explaining the patients that this is no longer an isolated treatment. We now only use treatment regimens, treatment protocols. We follow them long term. It's not one in, you're getting your neuromodulators and you're out. No. We start at baseline, we explain everything, because a lot of what we're doing at the beginning is not even visible. And this is one of the key concepts. How do you actually explain to a patient that I'm going to give you a certain number of treatments and you won't see anything for 2 months? This is actually what we're dealing with rapid weight loss. These patients are losing their weight slowly, and we're building their skin as they worsen their skin because of their weight loss. So we're trying to keep things almost at a status quo, but that's a lot of work.
Okay, let's dive into this.
Okay.
Let's dive into how we do treat patients like these. So first of all, how prevalent is medication-driven weight loss now in Canada?
Well, the Canadian statistics are lacking, but I'll give you an example. In the US, it's between 10 and 15% of the adult population has sought or is on these type of medications.
Growing, I'm assuming.
Absolutely, day by day. And these are GLP-1s. There's different categories. There's 2s and 3s coming. So we're even early on in the advent of all the medications that will be available. I also understand that there were shortage of these medications because they were primarily made for diabetes and other disease processes. So therefore, it was difficult to get. Now it's becoming a little bit more easy. We are very early on in seeing how our patients are going to evolve. One of my colleagues gives a great talk on this, and he talks about how industries are changing. The fast food giants are no longer selling the extra-sized meals. The airline industry is going to be saving fuel projected as of next year to the point where it will actually be a significant cost-cutting benefit for them because the airplanes will be lighter.
Oh my goodness.
So the impact of this is no longer just one patient losing 10 or 15 or 20 pounds. Imagine 400 of them have lost on average 20 pounds because some patients will lose 30, 40, and 50, and others don't have to lose anything. So you're changing the population of patients that we're interacting with at every level of society.
Wow. So it's so fascinating. So you mentioned something that on average they lose 10 to 20 pounds. Is that correct?
That's usually what happens with the GLP-1s, yes.
Okay.
There are different categories of medications, but the ones that most people are familiar with, you're losing anywhere between 10 and 20. Now, all of us know patients who've lost 30, 40, and 50.
Yeah, exactly. And we see in social media, celebrities,
Absolutely.
That's what's been media-sized. So,
Right.
yeah.
But the bottom line is it's usually a minimum of that amount of weight, and then depends that you shouldn't rely on the medications alone.
Yeah.
Exercise, lifestyle changes, dieting after the fact, maintaining your muscle mass, all these things impact the longevity of these outcomes.
Okay, so let's talk about how Ozempic or GLP-1s medications, what happens to your skin? Let's stick to the aesthetic for a minute.
So I like the fact that we're starting with skin because this is important. This is the largest organ we have.
Yeah.
And it actually is a very important organ. It not only protects our skin, but it also provides other growth factors and other signaling mechanisms. And what I mean by that is that if your skin is not healthy, it's not functioning properly. Your barrier function, you're going to look like you're more dry. You're going to feel it. Your skin won't heal the same way. So the first thing that happens is that the skin itself kind of dries out. And the skin and the dermal thickness, all of these things actually can change over time. So you don't look appropriately. You don't look like you have that glow anymore. You actually look a little bit like you're, run down, tired, dull.
Okay.
And these are measurable changes, and we know how to combat them. Add to this the fact that you're losing all this extra collagen in your skin. That means you've lost a little bit of collagen, you've lost a little bit of elasticity. All of a sudden, things are starting to drop and stretch. Hence, with all these changes starting very early on, many patients are happy because they look like they've lost weight. But what they don't realize is that this is going to worsen and worsen over time.
They are happy, you said.
They are happy.
They are happy.
They're very happy.
So they're not seeing their skin quality necessarily deteriorate.
Absolutely right. And this is one of the key things in education and why it's so important to go to the right source for information. Because it's very difficult to explain to a patient, your skin is not going to be great, but you need to start early on to protect it.
And they're feeling great.
And they're feeling great, and they're looking thin, and everyone's telling them how thin they look. And imagine a patient who's been 20 pounds overweight her whole life. And all of a sudden, that weight is gone. She's really not paying attention to her skin. She feels great. She may not look great in the mirror with respect to her fat pads and the shape of her face, but she's been thin for the first time in a very long time. That feeling makes them feel wonderful, like they're along the right track. We have to pull the brakes back and say, hold on a minute. You need to actually take care of your skin, because your skin right now, the way it's starting, it's going to be worse in 6 months. And in a year, when everything actually stretches out, it's going to be very difficult to reverse this. So one of the things that we came up with, even in our consensus statement, is that we should start treating the skin with biostimulators and things that can hydrate the skin immediately, right off the bat, within the first couple of months, even at the same time as they start their weight loss journey.
Tell us, common folk, what is a biostimulator?
Biostimulator are products that exist on the market that you inject and that can stimulate collagen, or other products that can hydrate the skin by improving the ability of the skin to maintain water and hydration.
Okay.
So these two classes of products are important because the biostimulators will stimulate collagen, therefore your skin will get tighter.
Okay.
It'll get thicker. It'll look healthier. Same thing with the products like that skin boost your skin that will improve hydration. It'll look better. There'll be a few less fine lines. Elasticity will improve in the skin. These are all measured with studies. So this is how you start. Once you have the patient's confidence, once they understand what you're doing, then slowly you'll start correcting other things if they wish for them to be corrected. Now, one of the things that happens after the skin are the fat pads. You have very superficial fat pads, you have very deep fat pads, and a lot of them actually dissipate. Hence why people look like they've lost weight. They become gaunt, their skin drops. It's because the fat that is inside the envelope is no longer pushing against the envelope, it's going away. Therefore, the skin drops. So one of the biggest concerns of a patient who loses weight quickly is what? It's appearing to have gained weight. So this is an even more technically difficult thing to teach, but we can and we are doing it. And that is to teach the injectors that you have to inject appropriately for these patients. You can't assume to know what they want. You have to show them case studies, previous examples of how you can raise part of the skin and pull things back.
Without looking like they've gained weight.
Without looking like they've gained weight.
So collagen and even dermal fillers, which are HA, can those sort of mimic the fat pads that you were saying that we've lost?
So the biostimulators will improve the skin envelope, but the fillers themselves, if appropriately placed at the right depth, you can actually fill in those fat pads. The trick is to choose the right filler to do the right thing.
Okay.
We have fillers that lift, we have fillers that project, we have fillers that volumize. We have fillers that go into areas of animation where you smile versus fillers that you use for chin projection. So every one of these things has to be evaluated and used in the context of the current patient that's in front of you.
Sounds like no two patients are the same.
Absolutely not.
Amazing. Okay, so you spoke a lot about biostimulators and dermal fillers, but certainly in the world of medical aesthetics, there's surgeries and there's laser. where would you recommend that GLP-1 patient goes in terms of their breadth of treatments that they should be interested in or ask questions about?
So I think that all patients who are following this weight loss journey need to be cognizant of the fact that their aesthetics are changing. Some will feel confident and want to get an opinion early on. Some will wait a little bit to see what's happening with respect to their weight loss. This is why medical education is so important for these patients, to try and get them in early in order to prevent all these things that are happening. Now, one of the things that I always like to say is that when all you have is a hammer, everything looks like a nail. You need to be able to get an opinion from somebody, or a group at least, that can offer energy devices, lasers, injectables, and surgery. Because some of these patients will absolutely need surgery. The thing is that you won't see it right off the bat because they're early on in their weight loss journey, but at least they'll have the confidence that if you yourself don't operate, you can send them to one of your colleagues who does within your group or whatnot. So it's really an understanding of when to time each specific treatment plan. And then that's the key word. Plan. Treatment regimens. No longer isolated treatments. So we think about when we're going to do this, how long it's going to take, and we have to think about when their weight will stabilize.
I was going to ask you that. On GLP-1s, does the weight ever stabilize at one point?
It does. And several patients will get off these medications and change their lifestyle and maintain that weight. So the key is that definitive procedures should be done when the weight is stable for at least 3 to 6 months, if not more, depending on the patient. So you don't want to think about surgery unless you're sure the weight is stable. You don't want to think about fat grafting a patient unless the weight is stable. Imagine you fat graft somebody in the face and all of a sudden they gain 20 pounds after that. Well, that's not a great thing.
Couldn't that happen with fillers as well?
Well, you can, but the advantage of the fillers is that you can reverse them. You can dissolve them, you can take them out. But also fillers have a limited lifespan. They'll last about a year, maybe 18 months, depending on the filler. If patients gain this weight back, they gain it slowly, gradually, and then they continue to gain. So the key is understanding what is going on with the patient. The psychology of the patient is very, very important here. They have to be very close to their clinician. They have to discuss these things. And it's a great question to say, how are you doing on your weight loss journey? Are you stable? Are you losing? Are you gaining? They will be very forthright and tell you what's happening because they will share their concerns with you. Just like they will tell you so proudly that I've lost another 5 pounds. And then that's your job to say, well, it's time for this. It's time for this. And are you exercising and are you eating healthy? And, you know, we are still clinicians. We're still physicians. We should be involved in all aspects of the
holistic view. And I love that as a patient myself. You want to be holistically taken care of. And I love that in medical aesthetics, it could be perceived as a more superficial or, beauty-driven industry, but really we take care of our patients in every aspect. And it's when you come and visit these experts that ask you, and it's important for patients to know this because then it might spark them asking those questions of their clinicians, the fact that you're mentioning that. It's important that they ask those questions, right?
100%.
And say, where do you think I am in my journey, and discussing those emotions with them.
Absolutely.
Okay, and so you mentioned energy devices and you mentioned surgery and so when should the GLP-1 patient even consider coming in for a consultation? Where in their journey should they even start?
As early as possible. Even if we don't offer them any treatments, they need to know what's going on. They need to know what to look for. They need to understand the process of losing weight and how this particular type of weight loss changes things. The only other group we've ever had that can be somewhat compared, but is actually very different, are the patients who had bariatric surgery, the ones that stapled their stomach or had those devices, and they lost a tremendous amount of weight. They're the other end of the extreme because they did not lose 5, 10, 15 pounds. They lost 50, 75, 100, and even 200 pounds.
Wow.
They essentially went into almost a starvation mode. That's why their blood tests were so important, to make sure their electrolytes and everything is fine. So they behaved very differently. They lost everything on their body and they ended up with massive amounts of skin requiring surgery fairly early on. This is a different process. There's a steady weight loss, and at some point in time, it teeter-totters and becomes stable. So you need somebody to be able to tell you those differences. You need somebody to tell you, you know what, look, you're doing great. We can use biostimulants, we can do everything we want, but you're going into a surgery track. Patient may turn around and say, I don't want surgery. I think I'm going to be happy at this weight. So having that foresight, that experience to explain this changes the evolution of the patient, and then they evolve in a way that they're comfortable.
So as somebody who's not in the medical field, quite obviously, how it's remarkable to me that you can be on top of these trends and on top of these new medications. How do doctors and physicians and specialists and experts stay on top of these trends and know what to do in the face of this brand new, essentially new situation?
So it's interesting. If you actually look at social media and you look up these particular topics, there's a lot of self-proclaimed experts.
Right.
And I'm not saying that there are only 2 or 3 experts, because there's a lot of experts. I mean, we use people from all over the world. One of the key things in creating an expert is making sure that they treat a lot of whatever it is that they're talking about.
Okay.
So if they see a lot of those patients, then more than likely they have that experience. So that's number 1, which means that you have to be in a center that gets those kinds of patients. Number 2, you need to be able to follow these patients long enough so you can't start treating them a month ago and become an expert. And that's the other thing that we're seeing. You have to have been treating them for a year or 2 and seeing the evolution right from the get-go when these medications came to market. And we saw that there's quite a few patients, even in Montreal, that actually did this very early on. So not only now do you have that experience, but you've also treated those patients over a longer period of time. You've seen them rebound or maintain their weight loss. You've changed their regimen based on what's happening, and you sort of evolve as the patient evolves.
So what kind of questions could a patient ask to find out if an expert is the one for them?
Well, I think the first question is, do you treat a lot of these patients? And sometimes they'll say yes, even though they don't. So it becomes a little bit more difficult. But what I would ask them is, share with me some of your cases. I'm sure that you have a series of cases that you can actually look at. And what is your experience if I lose 20 pounds in a month? And what is your experience if I lose 20 pounds over 6 months? Those kinds of questions will allow you to identify and be comfortable with the person treating you. Now, we're putting out a lot of education. We're publishing papers on the topic. We're giving international conferences on it. So the information is getting out there. It's trickling out there.
Okay.
And I can't say that we're the only group in the world that's doing this, but our group is at the forefront of it because we're the only ones that have actually published a consensus document that shows what to do for clinical experts. So I think it's important to feel comfortable, to understand and gain insight into the number of patients, the type of patients, how long they've been doing this. And at the end of the day, we're proud of showing some of the results from our current patients with their permission, of course. And that allows us to teach and to show to our existing patient population and our new patients that, you're in the right place.
Right.
This is what you need to do.
Yeah, gotcha. What's the most surprising thing a patient has ever asked you? A patient of this in this realm, a GLP-1 patient has ever asked you?
The most surprising, can't talk about that. Okay, so, yeah. So one of the most surprising things that patients tend to ask is that a lot of these patients find and get control of their lives, all aspects of their lives. So they start sharing a lot of information that is a little bit personal, which is fine because it's in a safe place and this is what you want to discuss. But you're starting to hear all sorts of interesting things like, what about this and what about that? And we're talking about some of the intimacy concepts. And, there are experts even within our city for male and female intimacy issues, medications to help these things along. They're starting to think outside of the box that they were in for many years. So I haven't been asked for medications for erectile dysfunction before, but I guess seem to get a lot of it actually happening lately because they're feeling great, they're looking great, and if they are of a certain age and they need a little boost, it's interesting.
Yeah, that's very fascinating. My question is, what is our obsession, or what? So there are a lot of theories behind beauty and why there's symmetry and there's proportions. What is it about weight that we as a species are attracted to?
So I think that weight is a very interesting concept. And depending where you are in the world, you will see that the ideal standards of beauty vary greatly. You have the Asian round, fuller face, which is very attractive. You have the North American sculpted, less volume on the face, higher cheekbones. You have other areas of Asia where the V appearance of the face is very important. So it all is geographically based, it's all ethnic based, and there are specific characteristics. So weight in and of itself, when there's an excess, even in countries where a fuller face is deemed aesthetically pleasing, and it is, when you go to the extremes, perhaps it's not so aesthetically pleasing. That's the issue.
Right.
So everyone has their own idea of what the standards of beauty are. The ideal thing is a normal weight, and what normal is depends again on where you are in the world.
Yeah.
Within that context of where you are and where your society is and what your sociologic environment is. But also what is a negative is the changes in weight that are abrupt. You gain 30 pounds, you lose 30 pounds. These
the
shifts,
yo-yo.
These shifts are what take away from somebody's ability to be, to try to maintain an aesthetically pleasing appearance. The yo-yoing. And the extremes. You've gained a lot of weight, you've lost a tremendous lot of weight. You want to lose a little bit of weight, you want to gain a little bit of weight. You don't want to be in the extremes. And those are the predefining things that we share, I think, all over the world. That concept of avoiding the extremes. Now, if you're in the middle, it's a normal distribution. Most people are here, some are there. You want to avoid being here.
Right. And when you do yo-yo, are there impacts on the skin quality?
Absolutely. And some of it, you can even think about what is a natural occurrence where somebody gains weight and loses weight, and that's pregnancy, right? It stretches the skin. The shape of the breast changes over time. The abdomen changes over time. And sometimes it doesn't recoil as much as you would like it to, especially after a second or a third pregnancy. Same thing happens with weight gain and weight loss.
Okay. As the National Medical Director of our over 20 clinics across Canada, how does this information trickle down to everybody?
The first thing we do is we actually formulate the information. That's where we talked about the consensus documents and all the research we're doing. And we're doing a lot of research on the subject, actually. Then we take this information and we break it down into segments that we can actually educate our own injectors. And we talk about the diagnosis and the treatment plans, essentially. Where is the patient along their weight loss journey? What do they need now, urgently? What do they need quickly? What can they wait on? And as the patient loses more weight, we offer every single option that's available at that time. And this happens every 2 months. We have, and now it's actually happening almost every month, where we have our medical education series within our own group, where we actually talk about all our findings, our recommendations, we bring case studies, we talk about those even rare cases that have lost a tremendous amount of weight, what you do next. And that's how we keep our group at the forefront of medication-driven weight loss. And for those of you who are clinicians, we will be presenting the large segment of the clinical research that we have been doing, including the consensus documents, at AMWC in Monaco at the end of March.
And for those of you who are patients or have a loved one who's on this medically driven weight loss journey, visit us at vigpart.com or follow us on our social media platforms, Instagram and TikTok, where we'll be sharing a lot more of Dr. Nikolis's nuggets of wisdom.